Alrighty, sorry about that, you guys. Thank you. We're just going to jump right back in. So, Brooke, would you mind telling us where we're at today?
Yes, so we are actually at the College of Pharmacy here at the University of Kentucky, and we are in one of our patient care labs where we train our students. I know we're talking about immunizations today, and so this area is one of the areas where we really get our students trained with some of that hands-on practice.
Yeah, that's so awesome. This is such a unique space, so that's so great to hear. For one of our questions, we'll just jump right in. Some people say that the vaccine has been rushed. What would you say to someone who is concerned?
Yes, so that is a great question. What we know about COVID-19 vaccines is that from the time we really started thinking about this pandemic to the time we had a vaccine is the fastest that we have ever seen. But what I would say, and a lot of the research that I have done in really looking at the vaccine, is that safety has remained a number one focus. So while it may seem that the vaccine was rushed and it was developed very quickly, the technology to develop this vaccine has been around for many years. And in fact, this particular technology with the vaccines that we have available today was actually touted for its ability to be able to quickly and efficiently develop vaccines. Now, we never knew that we would need to develop something this quickly per se, but but it is something that that we've seen and has really proved to be useful in our situation here. But I would say that every step, especially considering safety and efficacy, was followed. But when we have the entire world focusing on one disease state, right, and how do we make improvements here, it's kind of all hands on deck. So we had a lot of resources and individuals, a lot of people in the medical field and in science that are all working towards solving one problem. And so that has also contributed to the ability to develop this vaccine more quickly.
Yeah, most definitely. And I know right now there's so many just questions and concerns, both within our community and just the nation and the world as a whole. So that's why we're doing these questions, and hopefully, you know, we can bring some comfort to some people, most definitely. What are the differences between the types of vaccines?
So the vaccines that we have available right now are both the same technology, so the messenger RNA technology, and they are very similar, especially when we think in terms of their efficacy and their safety. We see a lot of similarities between the two vaccines that we do have available. I would say probably the biggest difference between the two is the period of time that you have to wait between getting the two doses. So both of the vaccines that we have available today are both require 2 doses. The Pfizer vaccine, there is a 21-day period between the 2 doses, and the Moderna vaccine, it's a 28-day period. So that's probably the biggest difference that we see from a healthcare provider standpoint. There are some differences as far as how they're stored or how they're dosed. But from a patient's perspective, you could probably expect about the same, except for that period of time in between for the 2 vaccines that we have available. Some of the other vaccines that we anticipate will be available very soon. A little bit different technology, may only require 1 dose, so there will be some more pronounced differences once we see some of the other vaccines become available.
Yeah, so one of the questions actually, people have been asking about when they would need to get another vaccine and how that would work. Would you mind just expanding a little bit more too? I know you talked about it briefly here, but...
Yes, and so that's another important thing to remember, especially with both the Pfizer and the Moderna vaccines, the ones that we have available. It's very important for individuals to ensure that they do get that second dose, because that is when we would consider someone fully protected or fully immunized at this point in time. So like I mentioned with the Pfizer vaccine, they need to get that second dose on or around 21 days after that first dose. Now, it may not be right on day 21, but you want to ensure that you at least wait those 21 days. And likewise for the Moderna vaccine, 28 days is what we say for that. So you definitely don't want to come in beforehand, and you don't want to wait too long after. You want to try to stay as close as possible. But depending on where you get the vaccine, the process should be very clear of how you come back to get that second dose. You will have a process that you follow to get back in for that second dose at the same location where you received your first dose. And another important consideration, aside from going back to the same place, but just making sure you get the same type of vaccine for both doses.
That's really good to know. Thank you so much. What vaccine is currently being administered here at UK?
So at UK, we are currently have both vaccines that are available that we're administering. So the Pfizer vaccine is being administered, as well as the Moderna vaccine, depending on the site and the supply and what is available. But again, we ensure that whatever vaccine a patient received the first time is the same vaccine that they receive for their second dose.
Yes. Okay, perfect. And what are some reasons, or actually what are some common side effects from getting the vaccine? I know that's a huge question, and it's actually prevented some people. So how can we do the facts and myths right now?
For sure. Yeah. So if we think about how vaccines work, just kind of generally what vaccines do is they almost trick your body into developing an immune response, so into thinking that the virus is present. And so when your body builds that immune response, you can expect some mild symptoms similar to what you might expect when you get sick or you feel bad. So things like a headache or just feeling tired, maybe even a low-grade fever. And that is just your body's signs of saying that, hey, I'm building up this immune response, getting those fighters ready to go. In the event that I'm actually exposed to the virus itself, then your body's able to fight that off. So those are the main side effects that we see. Also, the vaccine is going into the deltoid muscle of the arm, and so sometimes people complain of soreness at the injection site. So those are some mild symptoms that people can expect anytime that they get a vaccine, and really no different with the COVID-19 vaccine.
Yeah, thank you so much for that. What are some reasons someone should not get the vaccine?
So the vaccine has shown to be very well tolerated. Really, when we think about any vaccine or medication product, if an individual has allergies to any component of the mRNA vaccine, the vaccines that we have available now, so any of the ingredients, if they have an anaphylactic reaction or they have a severe reaction after receiving the vaccine, that would probably indicate that they are not able to receive the vaccine. Obviously, they would want to talk to their healthcare provider, and those that are providing the vaccine will do a comprehensive screening assessment before individuals get the vaccine to go through all of those questions with them. So I would certainly, if you think that you might have any severe allergies to components of the vaccine itself, then I would certainly talk to your healthcare provider to get those questions answered and those recommendations.
Yeah, thank you for clarifying that. And then, so for someone who receives the vaccine, would healthy practices such as, social distancing still, wearing a face mask, how does that help? And should people still be practicing those behaviors?
What we know about the vaccine and what we can be confident about is that it prevents severe disease or bad outcomes from COVID-19. We don't know as much about what it means in terms of transmission. We think that it helps reduce transmission, but we can't be sure quite yet. And therefore, the vaccine is not necessarily just a free pass to disregard all of the measures that we've been taking. So it's still important for individuals to wear a mask, to practice appropriate hand hygiene, to have physical distancing measures still in place even after receiving the vaccine.
Thank you so much. And why is it important for students? Why would you say it is important for students to get vaccinated? Excuse me.
Yeah, so I think the way that we are providing the vaccine right now, we are following the state guidance, and the state is using a phased approach to determine which individuals should receive the vaccine. And so when it is your time as a student to get this vaccine, when you fall within one of the phases where we are vaccinating right now, I highly recommend that you do sign up and get that vaccine. And sometimes there may be questions because, you're young and you're healthy, but really this vaccine is one of the tools that we have to help stop the spread of this disease. And like we talked about, all of the other measures are important things to do. The vaccine is another important measure as well. We know that the vaccine can help prevent those severe complications, and while they are less common maybe in our younger individuals, they still are possible to have severe complications from COVID-19, the virus itself. And so that will allow our students to be protected, as well as protect those around them. So we know there are many individuals that are at a much higher risk because of health conditions or because of age. And getting that vaccine not only helps protect you, but it also helps protect everyone around you.
No, most definitely. Thank you so much. And when can students, I know you're talking about the phases, but when would you say that students can start getting vaccinated, or what is the goal or hope?
Yeah, so I think it depends on where students fall within those categories. For example, our healthcare professionals, those that were deemed essential to caring for those high-risk patients and who were deemed necessary for the functioning of society, right? Those individuals were put in one of the top tiers. So if we have students maybe in healthcare colleges that are providing that direct patient care and have that patient interfacing, they may have already gotten their vaccine or already been eligible to get their vaccine. Students that may have some of the high risk factors as identified by the CDC, the Centers for Disease Control and Prevention, that may fall within 1C, for example, as far as the phases go, they can sign up and potentially be eligible and able to receive a vaccine now. So we're hoping that as more vaccine becomes available, we will be able to immunize more of the general population. It seems to be moving pretty quickly. We're getting good news about additional vaccine supply continuing to come in. So we hope to see students that maybe don't fall within some of those other categories have the opportunity to get vaccinated very soon.
Yeah, that is so great to hear. That is great news. And then Brooke, where are the vaccines and vaccinations being taken place?
So across the state, there are many different locations where one could find a vaccine. My recommendation would be to go to Kentucky's COVID-19 vaccine website. I think the website is kycovid19.ky.gov. And there's a really nice tool there to, number one, see when you would be eligible to receive a vaccine, to your question that you just asked, and also where they can find a vaccine. So there's a vaccine locator, if you will. But as far as at the university, the primary place that we are providing the vaccines is over at Kroger Field. And so we are having some other sites and of community events as well. But for the vast majority of individuals, those vaccines are being given over at Kroger Field. And it is an invited appointment, so
that's good to know.
Walk-ups aren't the method that we're using here at UK or really at any site. So any site where you would go to get a vaccine, you would need to work with that site. They usually have an online scheduling system that you can determine when that appointment would be.
Perfect. Thank you so much. And I just have a final, just kind of last question for you. What is something that you have enjoyed or taken away from just your position in your job throughout the midst of all this craziness going on?
Yeah, so I think as a pharmacist, I and all of my pharmacist colleagues, we've been providing immunizations for many years. Pharmacists have been providing vaccines for over a quarter of a century, and really just that ability to have a part and helping to be part of the solution and to help individuals stay healthy and be a part of that public health effort has just been really rewarding to be able to participate in, and getting people protected with the vaccine has been very enjoyable for me.
Oh, thank you. And we appreciate all that you have done, and as well as everyone else who's been making efforts in the midst of COVID right now. And so just thank you. Thank you for this time as well. And thank you all for joining us today. For more information, you can go to our website. There will be links provided. But Brooke, it was so great talking with you, and thank you for answering all these questions.
All right, thanks so much.